Hello, and welcome to Looking Up, A View from the Valley. My name is Mark Weissman, and thank you very, very much for watching. I'm very excited about this brand new television show that will hopefully be educational and informative for the entire family. If you have any comments on the show, feel free to provide feedback, questions, or suggestions to lookingupvalley@gmail.com or check out our Facebook page and dedicated website. Thank you very much. So one of the other things we want to talk about, obviously there's sort of the day-to-day and even and week-to-week things that you do at the health district, and that's sort of the internal thing that we've talked about, other than the inspections that you do on an ongoing basis. But for example, if someone is, a resident of the valley, is somewhere, whether it be at somebody's house or a business or a restaurant or things like that, and they see something that has them concerned from a health point of view, what would be the sort of the good course of action or chain of command of addressing that issue? What would you actually recommend to them to do?
People are welcome to call the health district and we speak to a sanitarian or speak to a staff person if you have a complaint you'd like to file about an establishment or a problem with rental property that you live in, or all of a sudden something is going on in your neighborhood that you think is of a public health nature. Certainly call the health department. You're able to talk with someone or file a complaint, and then
that actually makes me think, like, again, when I used to work in medical device, if somebody called and raised the question, literally that's all they technically had to do. In other words, as soon as we were inside, we were made aware of something, the onus became on us to address it. So my question to you is, if somebody calls verbally and says, I see this concern, do you then put on them, well, you have to file a written complaint, or can you actually immediately at that point move ahead with
from
something?
a phone call to our secretary during business hours, we'll take your information and then we will send someone out.
Oh, good. Excellent. That's good. And the other thing I was thinking too is it better, just, and this may not be officially, but more of a sort of from your experience, is it better for them to try, like if you're in a restaurant, to try to address it with restaurant management first, or call here first, or both, or what would be your recommendation in that case?
Well, it really would depend on the nature of the problem.
Okay, so for example, if you can give an example, maybe one that's already happened where somebody called where, they went to the restaurant first and maybe that was the right way or not the right way, just anything to help educate.
Well, for instance, if
would be.
we get complaints from time to time about someone who's working in a restaurant who's not washing their hands
Oh, okay.
when
Yep,
they're
sure,
supposed to.
Sure.
And that would be a situation where, I mean, if the individual is comfortable talking to the manager or someone like that to say, hey, and we've gotten complaints, you
Sure.
just did A,
Sure.
and now you're making my sandwich,
Yep,
you didn't
sure.
wash your hands,
Right.
I have a
Right.
problem with that.
Right.
Depending upon the type of reaction you get from the staff person over there, who either say, "Oh, I'm sorry, I'll certainly take
Right.
care of that," or they just don't seem like they care.
Right.
In the second case, then you certainly want to give a call
Sure.
to us, and one of our sanitarians will go out there and actually talk to the staff and make sure that
And
they
you go out-
understand.
And you go out anonymously, I assume? The person who called
yeah.
does not get involved
No,
in this, right?
we do
So-
not identify
Good.
people who call.
Good.
But we do go out and they would speak with the staff person or the manager and make sure that they understood the hand washing requirements, that they were doing it correctly, that the staff was properly trained and informed so they know.
And now that you've been red flagged by that particular restaurant for, let's say, improper hand washing, does anything get stepped up? In other words, you had you before, because I'm assuming before that you had your routine, where you inspected the restaurant and they went and made sure the training was in place and OSHA and all that stuff. And now you've gotten a complaint from a customer. So does that change anything as far as how you view that restaurant?
Not necessarily. Depending upon the cooperation of the management, will largely determine what happens. But the sanitarians have responsibility over specific areas, and they tend to go to the same places over and over and
Oh,
over again.
okay.
So they have sort of in their mind a history of that place, and they know whether this is an isolated incident or this is the kind of
point.
complaint that I
Right.
get that I see a lot.
Right.
And if there are cases where things are repeatedly violated,
Sure.
then we certainly will take enforcement action against
Sure.
that establishment.
And what sort of actions can you take?
We typically will call them in for an office meeting to discuss the type of problem that they're having, find out why it hasn't been corrected, and see if we can reach some resolution on that, a plan of action of some sort to make sure. And bottom line is, if the corrections aren't made, and we feel that there's a significant risk to the public, then we do have the ability to suspend or revoke their operating permit. It's sort of a court of last resort. We don't
Sure.
generally like to do that, but we do have that in, as an option.
Now, when you sit down with the people involved, what's the tone of the conversation? Is it more, well, what are you going to do this? Do you offer suggestions to them?
We do.
How does that work?
We usually have, the meetings usually consist of Karen and myself and the sanitarian who's responsible. And then the sanitarian will go through the problems that he or she's having that they've observed out there.
Okay.
What they've seen during either
Right.
a complaint investigation or as part of a routine inspection. And then we give the owner the opportunity to make his or her case about
Right.
what their situation is. And then we usually just try to talk it out.
Good.
Explain to them, make sure they understand what the correct procedure is, and see if we can't find a way to make sure that they do what needs to be done.
Now, one of the things you mentioned too, you said your sanitarian typically has the same area, so I'm sure he gets to know that particular business or that side of town or
Right.
whatever it is, which is good because familiarity it obviously makes you more experienced and things like that. But then I'm also thinking, the idea of cross training, where the typical the mantra of another set of eyes is always a good idea. Do you, on an active basis, again, independent of whether you get complaints or not, do you rotate your sanitarium so that somebody else comes in and may see things that the guy who's been there for a long time necessarily doesn't see?
We haven't really done that very much, but from a practical standpoint, what happens is, because of the way, particularly with our food service program, although there's 6 sanitarians on staff, only 3 of them actually routinely do routine inspections.
Okay.
And so they have, large areas of responsibility.
Right.
And what happens is they tend to move, they flow from one town to the next depending upon which establishments need to be inspected.
Okay.
And so if, for instance, Shelton gets a little bit behind on their restaurant inspections, we move some people over
Oh,
there
okay.
and they do so they get exposure in more
So there's
than one
so
place.
from a resource,
so they're not always looking
right.
at
So from
exactly
a resource standpoint, it happens that way.
it does just as a management
Yeah,
tool.
yeah, exactly.
because,
Yeah, like anything else.
We're involved in so many other things that depending upon the time of the year and what's going on, the sanitarian who has responsibility for that town may be tied up doing something
Right.
else. It's kind of
Exactly.
time sensitive.
Sure. Well, that's good, and that's good that you guys are able to react that
Yeah,
way. I mean,
and that's worked out very well for us. So we've had good luck with that.
Okay.
In doing that.
I was just thinking too, Karen. Does the Naugatuck Valley Health District is within? Well, first of all, let's clarify because I know there's always a question. Even when I started the show, what towns make up the valley? I want to make sure that I think you actually coincide with what my definition is. But you got Shelton, Derby, Ansonia, Seymour, right? Oxford, right?
No.
No, not Oxford. Okay, good to know. Who covers Oxford then from a health district point of view?
Pomperaug Health District.
Now where is that, or what is that?
It's made up of Southbury, Oxford, and
So
Woodbury.
more kind of northwest of the valley. Okay, Naugatuck themselves.
Naugatuck and Beacon Falls.
And so Oxford is of the 7 that we focus on.
We have
in this
6.
show. You have 6 of the 7. Okay, that's good to know. What sort of processes in place, if any, that you can learn from the other districts besides yourself?
Well, we have the Connecticut Association of Directors of Health,
Okay.
which are all the health departments, whether
Okay.
they're health districts or departments of municipalities.
What's the difference between district and department?
A department is one town only,
Oh,
one
okay.
town or one city. Quite often you'll see the big cities, Hartford, New Haven, Bridgeport.
Yeah, I was going to ask you because you said Weston and Westport are basically a district, right?
They're a district.
That's because Westport's a pretty big town. I was surprised that wouldn't be by itself. That's interesting.
Yes, but they.
Yeah, but they are.
And
They
they
do
were
that.
the first district.
Oh, really?
Yes.
Oh, look at that.
Formed in
Okay.
1966.
But you sort of, like you say, big
Yep.
Connecticut cities.
Yep.
by themselves.
But there's also the Connecticut Environmental Health Association and the Connecticut Public Health Nurses Association.
Okay.
So that the professionals are able to share ideas, meet several times a year
Right.
and share ideas
Okay,
and
good.
codes and ordinances and experiences.
Oh, that's good. Now the first one, the
Directors of Health.
how often do they meet?
They meet monthly.
Oh, okay, good.
Well, the whole membership meets every other month.
Okay.
And there's a board that meets in between.
Okay, good.
Yeah.
And then you come out of that meeting theoretically, and then disseminate down to your staff. What you've learned from other districts.
Share what we
and
learned,
things like
yes.
that. Oh, that's great. Okay, good. Where are those meetings held? I'm just curious.
Well, they rotate around the state.
Oh, good, even better. That's
become-
smart.
yep.
Yeah, that's good.
Yep.
So no one has sort of an advantage, like a
No.
home field advantage. That's really good. Okay, well, thank you very much. This has been great. I mean, I've certainly learned a lot. Hopefully, our viewers have learned a lot too. So I want to thank you,
Thank you.
David. Appreciate it.
Thank you for having
Karen,
us.
no problem. So now we're with Amy Shields, the public health specialist, or one of the public health specialists at the Naugatuck Valley Health District, and Patricia Sullivan, who is a public health nurse and does a lot of other things actually within both the Novell program and the health district in general. So thank you, ladies, for joining us today. Appreciate it. And just like we did with Karen and David, just to kind of so the viewers get a little idea of sort of how you got involved with the health district, or even before, what's your education, a little bit even personal background.
Well, I was born in Rhode Island, but was only there till I was 2 years old.
Okay. Okay.
Then I moved to Sterling, Connecticut,
Okay.
which is pretty much Cowtown.
Okay.
Lived
Where
there-
where is Sterling?
It's, I'm trying to think of where. It's right by, across the border from Coventry, Rhode Island.
Oh yeah, sure.
Yeah, you could pretty much walk 5 minutes and get into Rhode
Wow,
Island from where.
okay.
But I lived there till I was 15, 16, moved to Pomfret,
Okay.
northeastern part of the state,
Right.
and went to Woodstock Academy for high
Oh,
school.
there you go. Okay, sure.
And then I went to University of New Haven for my undergraduate degree.
Mm-hmm.
Got a bachelor's in nutrition.
Okay.
And from there I went to Southern to get my master's in public health.
Oh wow.
And it was...
Were you still living up in Pomfret during all that, or did you
No.
live down here? Okay.
Yep, lived in New Haven. Then I just got an apartment, stayed around the area
Sure.
for masters and everything. And pretty much when I got my degree in nutrition, I didn't really want to become a registered dietitian right away or do any
Mhm.
kind of clinical. So I thought that public health would give me a lot of different options of what
Sure.
I really want to do.
Sure.
During my
Was there something about that when you said you didn't want to do it? What was it? What was more attractive somewhere else or less attractive?
I guess I wasn't sure if I wanted to do, my own practice with one-on-one counseling.
Oh, okay.
At the time, right from school, I was at diet tech at Yale Hospital,
Mm-hmm.
and I wasn't even sure if I wanted to work in a hospital setting either.
Mm-hmm.
So I just thought it's something I can always go back to and get, but this would give me more opportunity also to do maybe community engagement
Oh, yeah.
around nutrition education, etc.
That's right.
So when I went to Southern during my second year, I need to get an internship. So I did that at the Milford Health Department,
Mm-hmm.
and that ended up leading into a job as the emergency preparedness coordinator there.
Oh wow. What were
For-
some of your responsibilities with that job?
Well, I was the city's readiness initiative coordinator. That was my main focus, or the grant that I was under.
Mm-hmm.
And basically, the whole idea of city's readiness initiative is in the event of a bioterrorist attack,
Right.
that each health department will be able to get medications out to their total population within 48 hours of the decision to do that.
Wow. Wow.
So that was kind of what it fell under,
Right.
and I basically worked with surrounding health departments to make sure they had the appropriate plans in place. They tested them,
Mm-hmm.
had their staff trained, volunteers trained.
Wow. And all of this under the auspices of what if something were to happen, as opposed to ongoing, some of the things that David and Karen and the district does on an ongoing basis.
Yes,
Interesting.
very much
Wow.
kind of planning
Yeah.
and also just making sure because it was under a grant from the state, making sure everything was reported to the
Oh,
state,
sure,
et
of
cetera,
course.
and
Yeah, of
that.
course.
So.
Okay.
And from there, I knew I didn't want to fully focus on emergency preparedness all the time. I wanted to get
Right.
back to my nutrition background a bit. And
Mm-hmm.
the job for public health specialist came up here little less than a year ago.
Okay.
And I applied for it and started here last September. So
Okay.
it hasn't quite been a year that I've been here. But
Wow.
so.
So, do you find yourself now using that nutrition background while you're here?
Somewhat, yeah, a little
Mm-hmm.
bit more. I do more community education
Right.
and things like that.
That's right. In
and-
fact, we met at the Shelton Library,
Yes.
where you were talking about some of the efforts that the district does. So that's,
Yep.
yeah, that's right, and that was good. So, so then, let's talk about your responsibilities now here with the district. If you could, just maybe the top three, or what are your main, day to day or week to week, what do you find yourself doing, in support of the district?
Well, like you said, that we met out when I was in Shelton. Some of it is just community outreach and education. So in January, it's Radon Action Month. So we gave out radon kits and got out to the libraries, some senior centers, and got information out and gave people free kits.
Yep.
Just recently, I went out to senior centers and also worked with students from Sacred Heart University.
Oh, really?
And we did presentations about emergency preparedness to
Okay.
the elderly population and to caregivers of the elderly.
Sure. Yeah.
How to be prepared and also how to help out your loved ones
Yeah,
during a
exactly.
disaster.
That's great.
And one of the main focuses right now is where we have a volunteer force of about 60 individuals right now. We're looking to formalize it into a medical reserve corps. So we're going through the application with that with the state and also the feds. And during the summer, we're going to start recruitment for the MRC and start building our volunteer force and start to do trainings on things like shelter operations. So
Oh, okay. Wow.
it is hurricane season, so
Yeah, good point.
and
Good
just
point.
because of the Hurricane Irene,
Right, exactly.
where
Yep.
there were a lot of problems with sheltering and everything. So that's going to be one of our focuses is getting trainings and getting people trained to help staff a shelter. And
Okay, good. That's good.
So-
Now, like you mentioned, the radon, and there's Nouvelle, which is specifically the lead program, correct?
Yep.
Is that right? Other than those two things, or I guess does radon have its own? I guess is there not enough of a need for radon to have its own sort of division, and beyond those two, are there other things that either you get involved or the health district gets involved?
I guess I could see radon more lumping into
Everything
another
else?
Yeah.
Okay.
But it does seem to be kind of under the radar. Many people we found didn't realize that it's like the second leading cause of lung
Yeah.
cancer next to smoking. And
Wow.
I didn't even realize how much there was in the valley until I kind of looked up some statistics and everything.
Right.
So
And actually, I'm really glad you phrased it that way, because I'm assuming every district or city in the United States has some sort of health watchdog, basically. But now you mentioned the valley, and everyone knows this area was all industrial. From really Shelton, Derby, all the way up Naugatuck and beyond.
Yep.
So thankfully, a lot of the things we know now. To how to address it. Like, for instance, the river has gotten cleaned out. I think it was one of the lowest rated rivers for a while. It's now second cleanest, and the only one that's cleaner is the one that's right above it. Things like that. So I think that's a testament probably to some of the things that's being done in this district. Because of the type of industries that used to be here in the 40s and 50s, are there regional things that from, I know it's limited experience, but just that you say, oh wow, because we live in this area where there was these particular types of factories, and that's just one example. Are there other things that you have to be on guard for?
I'm not positive about that one.
Okay,
I
no
don't-
problem.
I don't know if any of that would link at all with asthma, Trish, or not, but
Oh,
I
that's a
know.
good point. I hadn't thought of that. I mean,
but that
so
might
you get
not
involved
have
in
any
asthma,
correlation. But
sort
Yes.
of. So I guess inhalants and things like that, of what would actually happen. So maybe if you want to talk a little bit about that, that'd be fun.
Sure. Putting on Airs is the name of the asthma program. It's an in-home program. It's really a lot of education. It looks at both the medical component and the environmental section of the home.
Because I was going to ask you, the medical component and environmental. You said?
Yes.
What do you mean? What is the difference between those
Medical
two?
component would be based on the child's what they call asthma severity.
Oh,
Basically,
okay.
their symptoms and how often they get these symptoms.
Maybe a predisposition if you're already predisposed to having asthma, even without the environmental thing?
No, it's really
Or not
based
really?
on symptoms. How severe is your asthma?
Oh, I see.
How bad
Okay.
is your asthma?
Okay. Now, if the asthma was caused by like an allergen, like having a cat in the house, do you actually differentiate? In other words, you're only going to address asthma that's environmentally related from, like
No.
what? Or do you cover?
I cover all
It's
the
asthma
asthma
is
triggers.
asthma.
Yes,
Good,
we
that's good.
focus on the environmental section, but the the really big component is the educational piece.
Okay.
So I'll go in and sit down with the family,
Wow.
usually at the kitchen table, and
Okay.
go over everything, what asthma is, the fact that it's a chronic illness.
So how do you pick which families or which houses?
It's
to
a
go to?
volunteer referral program. The parents basically say they are interested in the program. Their pediatrician might refer them.
Ah, okay.
Their school nurse might refer them. They might refer themselves from a health fair or just word of mouth. And
Now, you also mentioned school nurse. Now, you mentioned me earlier you were a substitute school nurse.
Yes.
Where was that?
actually in the Bethany
Oh,
School
okay.
District.
So,
Yeah.
and some people, I ask them who's in the valley, they say Bethany's part of the valley. So you never know. But okay. So do you find yourself from what you learned? I don't know how long you did that for, but does that come into play when you actually talk to the kids and the parents about things going on in school at all, or not really?
Oh, it does a little bit. I think everything that you learn along the way, even, my brother and cousin had asthma very, very badly, and that was like 30 years ago. Just to
Right.
see how the care for asthma has changed since then.
Exactly.
There's so many better medications out there, and then the fact that you have the inhaled corticosteroids. And it's important for families to know this. It's important for families to know that asthma is a chronic illness.
Yep.
It's not something that goes away.
Right. Do you know, and this again, I'm just asking out of curiosity, do you know other, because it seems like there's over the counter and prescription inhalers, like you mentioned. But beyond that, is there what's being done to work on a cure for asthma? Do you know if anything's going on that side of things?
Not really. There is no cure currently for asthma. The main goal of asthma is control.
Right, exactly.
And you want to be able to live a normal life as possible. And you can do that if your asthma is under
Sure,
good control.
sure.
I have to just correct you for the over-the-counter meds,
That's okay,
because
no problem.
really, we don't want people using those, and they like Primatene Mist.
Yes, that's been
that's
taken off
gonna
the
be
market,
taken
right?
off the market.
I actually went to buy it.
Yes.
I use Symbicort because I have asthma. I've been my doctor's given me Symbicort and albuterol, right?
Okay, yep.
Albuterol. And so I've used those two, and I ran out, and he wasn't around. I couldn't call. Where's all the Primatene Mist? I think they had tablets, but not inhalers. And I got all different stories. That was the interesting thing. Once I heard the one, I went to the next one and said, "Oh, I hear this. Oh, no, actually, it was a voluntary recall. No, it was a forced recall." I mean, I don't know if you can shed some light on that. If you know anything about the sort of the FDA side.
Well,
of
you
things.
shouldn't be using over-the-counter
Okay.
meds when you have asthma.
Well, why not? Why not? I'm just
Because you
curious.
should be followed by a specialist. If you had diabetes, which is a chronic illness,
Right.
you wouldn't be thinking to go buy things over the counter
True.
to treat diabetes. And this is
point.
the point that I try and make with families, that
Yeah.
asthma is a chronic illness like diabetes is a chronic illness. So you almost have to look at treating them the same way, just different parts of the body.
Right. So if a family or a parent, let's say you go, like you said, one-on-one, but let's say somebody watching this, hasn't had a chance to talk to you or talk to the district, what can they do? What kind of proactive thing can they do to address
Call
it?
the health department and schedule
Okay.
a home visit.
Okay,
It's
good.
a free program. You don't get charged. The insurance doesn't get charged.
Oh, great.
And,
That's good.
Actually, the family's followed for 6 months.
Okay.
So, and we look at emergency room visits, school absences,
Oh, wow.
urgent care visits to the physician, and hospitalizations.
Okay.
And
But could they
hopefully-
call you even if they're not? I mean, if I heard that, I'm thinking, well, maybe my child has to be to that extreme before I call. I mean, can they call you even if they suspect that their child is dealing
You
with
really
this?
need to have the diagnosis of asthma.
Oh, okay.
So,
Okay.
that's the way, unfortunately, the program's
Well,
here to
you
go.
have to. I mean, your time is valuable, and I'm
Right.
sure that's got to be, part of it. Oh, you mentioned the 6 months. So what happened? So you monitor and you're sort of intimately keeping track. After the 6 months, though, what happens?
We basically discharge the resident,
Okay.
and hopefully they've learned enough of the tools to take with them
Okay.
and manage their child's asthma.
Okay.
So
And if they ever had to call back and could they?
we have had that, yes.
reinstate? Sure.
Yes,
yeah.
they can call
Yeah.
back anytime they'd like.
Oh, good.
2 other full-time nurses are community nurse supervisor is
Okay.
Deborah Horvath. She's actually a nurse practitioner.
Okay.
And she oversees us all in the community health division.
How does a nurse practitioner differ from a registered nurse?
They have different credentials and different schooling. She's gone to school a little bit longer, and
Okay.
she can do different things. And
Like, well, for example, what's one thing she can do that a registered
well, she
nurse?
does. When we used to do physical, she would do the physical exam.
Oh, okay.
So there's another nurse that works with me, Patricia Richards, and she looks at the communicable diseases such as tuberculosis. She'll look at respiratory outbreaks, if there's GI outbreaks. She works hand in hand with our epidemiologist.
Okay.
That has kind of like a satellite office here.
Oh, okay.
That works out of DPH.
Right.
And that's Paul Gasek.
Okay.
We also do flu clinics. We do vaccine clinics. One of my other positions is working with children that have elevated lead levels or are lead poisoned
Oh, okay.
until they come back to a normal level.
When you mentioned the flu vaccine, is just on the surface, is there an advantage, like for me to come here and get vaccinated versus a CVS or a Walgreens or things like that?
Well, you're going to have a nurse that gives you your vaccine here.
Okay. Who gives it at those other locations?
The pharmacists are trained to give it.
Okay. So it's not necessarily a nurse.
No.
Okay. Okay, but does that, I mean, honestly, does that really, it's an injection. As long as they're trained to give that injection, does it really matter? I'm just wondering. Or is it, or I guess I'm answering my own question, but I'm thinking if something else is going on, you may be more likely to say something, and then the nurse can pick up on it that maybe somebody else would have. Is that, I don't know.
Well, I just, I like to protect the nursing profession
Good,
and say
and so
I'd
you
rather
should.
have a nurse give an
Okay.
injection than a pharmacist. Not that they're not able to do it, but I just think
They probably don't do it on a regular basis the same way
Yeah,
you
because
do.
even not being
Right.
a nurse, I would rather go to a nurse
Yeah,
than to
Interesting.
get
See,
by than
I mean, I think so too, but yet I've gone to other ones and have no problem. But yeah, you're right. That's true. You're right. If there's any qualms, you're right. You probably want to go to somebody like that. Okay. If you have any comments on the show, feel free to provide feedback, questions, or suggestions to lookingupvalley@gmail.com or check out our Facebook page and dedicated website. Thank you very much.